Good evening, Malden. I'm Gary Christenson, Mayor of the city, and we are back with another COVID update, which we were hoping after our last show that we wouldn't have to be back for several months. But as you all know, there's been a change. And so that's why we wanted to come back together tonight, especially with the holiday season upon us. So as always, we're joined by Scune Carrington from our Board of Health here in the city of Malden. We also have our Health Department Director, Chris Webb, and I think he's made just about every show, Lanphere from Cambridge Health Alliance. None of this happens without our Communications Director, Ron Cochran, so I want to thank him. And then, of course, our host, Urban Media Arts, who I think has told me we are now up to 34 episodes. So not something that we wanted to do, but it's something that we have to do, and that's why we're back together tonight. So what I first want to do, as we've done in the past, just allow our panelists a couple of moments to say hello to you and how to get a hold of them if you need them after the show. And then we'll get into this evening's questions. So let's start first with our Health Director, Mr. Webb.
Good evening, everyone. Great to be back again. It's unfortunate, as the mayor said, that we have these issues coming upon us, but I think they're more than manageable. And we'll explain why we think that as the evening goes on. But if you want to reach me after the show, the best way to do that is to call 781-397-7049 or email me at cwebb@cityofmalden.org.
All right, very good. Over to you, Christian.
All right, good evening, Malden. Christian Lanphere, I'm with the Cambridge Health Alliance. I can be reached at clanphere@challiance.org.
Very good. And Scune.
Good evening, Malden. Thank you for joining us on, I guess, the last few weeks left in the year 2021. So I'm excited to provide you with updates and answer some of your questions. And if after the show you want to reach me, I can be reached at bohresponse@cityofmalden.org. And I'm a member of the Board of Health and excited to be here.
All right, very good. Well, I think the question on everyone's minds is this new variant. So what do we know and what don't we know? So let's start with Chris, and then we'll go to Christian, and then over to Scune.
Well, there's still many things that need to be confirmed. We're learning more, but the data is short. And if you're only looking at a couple of months data, it may or may not be the most reliable 6 months out from now. We'll see how that looks. But from my look at Omicron, from when it was in South Africa to its movement across, I think you and I talked about it, Mr. Mayor, some weeks ago, that it wasn't having the hospitalization effect or serious illness in South Africa. So that was a major sign that, yes, while it may be more virulent in so much as infectious, it wasn't as dangerous to the average person in South Africa. So there was no reason to believe it would be different on another continent, but we had to wait and see, and that data is still holding up. So I would tell people that while Omicron is definitely not Delta, which was probably more to be concerned about, I would say that any infectious disease is one you don't want, no matter how mild your interaction with that disease might be. So get out and get vaccinated, because you don't want to be that person who's still spreading the next variant that is as dangerous or more so than Delta was.
Okay, over to you, Christian. What are you hearing and seeing?
So I'm going to agree with Chris. I think that the data is still short on this, and I think we still have a lot to learn. I think in the short amount of time that what we have seen, and we're really looking at the UK now. The UK is, their rates have gone skyrocketing, and these are most likely Omicron related. However, while their numbers continue to rise exponentially, their hospitalization rates remain very low compared to the United States right now. The United States is starting to see a bit of, we're starting to see a little uptick in COVID cases, but we're seeing considerable hospitalization rates, which is very much related to Delta. So we really do need to encourage vaccination efforts and booster shots, because Delta is is still very much prevalent in our communities at the moment.
And Christian, before I go to Scune, you always make this point of those hospitalizations, the vast majority are the unvaccinated still?
So we are all hospitals in Massachusetts right now are seeing very high levels of volume. We are seeing increasing COVID-19 volume. And again, it remains many of the patients who remain hospitalized are the unvaccinated. And we are seeing we're seeing an increasing number of patients who got the primary series vaccines, not the booster in the medical surgical units, but the vast majority of those in the critical care units remain unvaccinated.
Okay, very good. And over to you, Scune. What are you hearing and seeing?
So definitely some agreeing with Christian around some of the breakthrough infections, but the nature of viruses, that's what happened. They evolve and they get stronger and they get to learn the body and the antibodies and how to fight them. So I think we're going to talk about this a little bit more around booster shots and if you've had one or two or the first Johnson & Johnson, just like what you can do to basically prepare yourself to for this new variant and evolution of the virus. And there's probably a lot more in the background. So like the masking and the vaccination, if you haven't done the one or two, and the booster shots, because it's weaning off based on how long you've had your series. I think these sort of like messages drilling those in, but the ones that are vaccinated, overwhelming some of the hospital systems is among the unvaccinated.
Okay, very good. I'm going to stay with you, Scune, and work my way back. So now that we have said repeatedly, you have said to our audience time after time that the vast majority of people that we're seeing hospitalized is those that are unvaccinated. Why hasn't the country or the state just said, you know what, enough's enough. We know what we're dealing with. As of a certain date, we will need to be vaccinated or else. Of course, outside of the exemptions, medical and religious. Why don't you think that time has come? And I'm going to ask Christian and Chris the same question. Or do you think it will come?
So I think with mandates specifically, I think it will be up to, like, you have private businesses, you have some employers that do require
Right,
it
on their own.
on their own. So I think that decision remains rather than like a blanket one across the board. I think why it hasn't happened, I know folks that haven't been vaccinated because they're afraid of needles and we don't have therapeutics yet out there. And then like with the testing. So I think each individual, either cities and businesses, need to make the decision themselves. So rather than a blanket one at either the federal or the city level, if a restaurant, for example, there's indoors and, and it's getting colder and ventilation and all of that kind of stuff, if they make the choice to require vaccine cards, which I have mine, I actually have mine not laminated, like inside of a little card and carrying it with me because I have been in other places that have required a vaccine passport. So I think we might come to that rather than a mandate, but to have a vaccine passport to show that I have had the booster and all that stuff to really just get a handle on it. But I don't think we're going to get to a point of a mandate.
So Scune, you almost think that may be a way to be more effective, is by letting sort of the market determine, the businesses determine, the private.
Yes, the cities and the jobs
towns
make the determination on what works the best for them, because what may work for us may not work for our neighbors next door or Boston in terms of volume, or people in Western Mass. So I think that blanket mandate, maybe it may not make sense across the board for everyone.
Okay. Yeah, and there is something with that word that we have seen here that just, really throws people off. So
Absolutely.
maybe you're onto something. Yeah. Christian, what do you think? Same thing? Do you
So,
think we'll see something across the country at some point, or do you think?
I think it'll be the private sector that sort of sets the standards. I can certainly appreciate what Boston's done. I think it worked very well in New York. I think we've seen it working in Europe as well. Europe's certainly got their vaccination rates are fantastic, mostly because people can't even go out into restaurants or stores. You really can't live your life without having some type of check that says that you have been vaccinated. And, you know, we really do we have a strong mechanism. We have a strong defense system in this country, and that is a vaccine. And so regardless of, you know, people's, you know, their politics or their own beliefs, we still, you know, this is for the greater good. And I'll tell you, I am quite frustrated by the number of people who are literally in the ICU on their last breath, you know, either begging for the vaccine now or considering that this is still a hoax. It is still troubling. And you hear these stories across the country. In our own little hospital, we're hearing the same type of stories. And even in Massachusetts. So while I applaud Massachusetts for having, you know, very high vaccination rates, we're still not done. And we still got to keep at this.
So Chris, based on what Christian just said, that, you know, he has heard and seen people on their last breath, are you surprised at this point that the country hasn't just said enough's enough? Everybody's going to do it?
No, I'm not surprised. It comes down to a lot of different things. The main one, I think right now, if we speak about it today, is that the horses left the barn. The time to do it would have been last winter.
I see.
And then you would have been rolling through your seasonal changes and having you know, more time to get it done before the next boom took off. And I showed you a graph the other day that shows in 20, starting January 20th in 2020, the demand for testing went through the roof. Shortly thereafter, maybe 2 weeks later, it was gone, and it continued to drop off and drop off and drop off. By August, it was down to a couple of thousand tests a week. Then school started at the end of August, beginning of September, and the demand needle just went straight up all the way until Christmas. It's climbed all the way. People are looking at the testing the wrong way. You shouldn't be testing before you go and do something you shouldn't be doing. You should be testing after, because you're there anyway. It doesn't matter whether you're positive before you get there, positive after you leave. You're going to be positive if you're not protected. The state put out some interesting numbers today too in a press release that says that 99.9% of breakthrough cases among fully vaccinated people under the age of 60 did not result in death. Among the breakthrough cases for residents over age 60, 97% did not result in death. There's 97% of the rest of the population is vaccinated, doesn't even end up in the hospital in a breakthrough situation. So I think that there's a lot of reasons why a mandate doesn't work. It's almost impossible to enforce. It leaves the store or the business owner responsible for the enforcement more than 90% of the time. I don't know if that right now is the best thing to do. And the last reason I would give is that the city of Malden has 76.9% of its people double dose vaccinated. There's 86.3% only single vaccination. So if we get that 10% gets vaccinated over the next 3 weeks or 6 weeks, let's say, depending on when they came in for vaccination, you know, we're looking pretty good at the start of the new year. Would be in the, you know, mid 85 percentile, which is what we're kind of been seeing all along, and we're tracking, and that's kind of where we thought we'd be, considering all the things that we do know. So mandating it is going to, for the city of Malden, is kind of backward now. We're going to be in the 85 percentile, at least 15% of the population. And generally, I bet more than half of that 15% are school-age children who can't make the decision for themselves. So there we are. You know, I think Malden's taken a very good tact on getting vaccinated. It's just taken a little longer than anybody would have hoped for. But I don't think mandating speeds that up.
Okay, very good. Before I get to the next question, Ron, any phone calls? And do you have a long list of questions that came in via YouTube?
We've had some questions come in. I think it's probably, we'll sprinkle them in, but what's appropriate to ask one of them in particular, because it's topical to what was just discussed.
About testing, right?
Yeah, no, actually, this is surrounding what was just spoken about with the vaccine. So this is a question that's an old question that's been rebooted several times through the pandemic, which is, what is the latest science on vaccination with respect to the individual who has been vaccinated, spreading it, or is it shifting more towards just, a therapeutic in a sense, or is it both?
Okay, who do you want to start with, Ron?
Let's go over to Christian on this one. I think that's what we're going to start before.
Well, so our position is that you can still pass the virus. That's been our position, which is why masks are still are necessary. I think that regardless of brand, I think that getting the 2-dose series of either Moderna or Pfizer are still very good. Although the data has been very good, very clear about just how effective the boosters have been for COVID, the original COVID, as well as the Delta series. And we are obviously looking for additional data on both with Moderna and Pfizer and how they're stacking up against the Omicron. I know that there has been press releases around this, but again, I think we go off of the science, and that data is still being worked through. But we consider people to still be able to pass the virus, even though it doesn't lead to illness. And I think we need to remember that these vaccines were never designed to prevent people from getting COVID. They were designed to keep people out of the hospital. That is what they were originally designed for. And as you can see, these vaccines have done a very, very good job of keeping people out of the hospital. But what we have seen is we have started to see immunity is starting to wane in people who got their first and second doses early in the year. And now those COVID infections are starting to climb. And then, of course, what we have seen now with huge rises in volume in our emergency departments and hospitals is really the post-Thanksgiving holiday. And so for many of us, both in the healthcare and the public health entity, we are certainly bracing for January as well. So I don't want people to think that simply because you are vaccinated with the booster, that you are free from either getting COVID or transmitting COVID.
Christian, one more time. I think it's worth you repeating to our viewers that the vaccine was designed for a certain purpose. It was not to be the end thereof. So can you say that one more time?
Yeah, the one myth I hear a lot is, well, I've been vaccinated, so I can't get COVID. That is not true. These vaccines were never designed to prevent people from getting COVID. They were designed to keep people out of the hospital. For people, we have seen it, and I'll tell you, I am living proof, because I see this every single day over this past year since these vaccines, how effective they have been at keeping people who have been hospitalized either with breakthrough infections. These symptoms are mild compared to what we saw pre-vaccines. It is literally night and day. I cannot describe enough just how effective these vaccines have been keeping people both out of the hospital and keeping the symptoms mild for people. And people of all races, people of all ethnicities, males, females, you name it, it has been effective in all groups. These really, really are very good vaccines.
Okay, Ron, good question. So let me talk to Scune and Chris about something that Ron and I have been hearing a lot about over the past couple of days, and that is the distribution of the test kits that we received from Governor Baker and Lieutenant Governor Polito. So when we spoke with you about coming up with a game plan, we do want to thank you publicly for the plan you have come up with, which Ron and I think has already been effective. We understand today you distributed roughly 5,000 of those kits. So Chris and Scune, I'll start with Scune and then over to Chris. Tell us the rationale and, where do you think we go from here after we distribute all of these kits?
Okay, just want to thank the governor for these kits. And I think the rationale is around the equity issue rather than like a first come, first serve. And I think Chris is gonna dive into the details of it and approaching it in that way. And in terms of where do we go from here, I think it remains to be seen, but at least we have at least some starting point and a way for people at home to be able to find out their own sort of like status. And
Okay.
yeah.
Okay, and Chris, I know you worked with your team, Tamale Rock, Maria Tamagna, et cetera. So so you received this notification. What was the thinking downstairs?
Well, it was excitement at first, and then when you read the fine print, like most things that come with no price tag on it, it was designated for low income people of in low income neighborhoods who typically aren't as deep pocketed as someone else who might be able to buy a test kit just so they can go visit family this season. The other thing is that's predominantly where the positive test results are coming from, mainly.
So this was a good thing. I mean, you turned to our community partners to help accomplish the goal, right?
Absolutely, and our community partners are really going to get it into the hands of the people that it was designated for, first of all, and that has a lot of public health reasoning behind it. These are the folks that are maybe sending their kids to school sick and giving us problems in our schools. That's one big, right off the top of my head, was the first thing I thought of that would be helpful. But obviously, if people aren't vaccinated and they're going out or they have gone out and they feel they're symptomatic, that's what these tests are for, to inform them and get it into the hands so they can test themselves periodically without worrying about cost. I know it's a burden for everybody. Some people still aren't working, and another $50, $60, $80 a week to stay in the test kit game is not what anybody planned on. But to just beat everybody to the point on this, why isn't everybody getting one, is we didn't get 70,000 test kits.
Yeah,
we got 18,000. And there's a reason for that. Those are the number of people in our community that fall below the median income, or by 5% or more. So it's a tough situation to be in, to have to make decisions on. Yeah. But if people, are coming to us and tell us their situations, we can help, and we will. City councilor is a good place to go to if you want to talk to your city councilor about the testing you feel you need. If we can help, it's an issue of being affordable, then we can help with that. We do keep track of every issuance of the test kits so that we can show where they're going and how quickly they're going. Like I say, we will have some pop-up events in community locations that designate the low-income territories of our city. And, we will get more of these out into people's hands between now and the new year. Yep. Another point, one last point on this issue. The governor did not put these test kits out for people to get a ticket for turkey. They are a test tool so you do not spread disease, not so you can enjoy, staying unvaccinated and going to people's homes. That's not what these test kits are for. They're not for protecting anybody, but informing the individual who's taking the test. That's the most important thing that people have to keep in mind with these tests. Hopefully, if the situation warrants, I'm sure that additional testing will be made. We would set up additional test sites. That will all come back to be when the demand is expected.
Yeah, very good.
Right
and
now,
so,
and
we're going to go back to Ron after, but I do want to let our viewers know that everybody on this call, I think, really has turned their attention to testing and vaccination. So on the testing front, you just heard that we did get a preliminary and number of tests from the state that we are working with our partner organizations. So Bread of Life, Housing Families, Malden Neighbors Helping Neighbors, we're putting some aside for our first responders, but it is our intent, working with our controller, Chuck Rannigan, to utilize the state contract that's being put together to have someone working on this year round to have tests for the larger community going forward. So we'll keep you abreast of that once the once we have more information, but it would be our intent to be able to have these widely available going forward. So let's go back to Ron. Ron, I know you had a few questions queued up. No one has come in via the phone yet, right?
Not yet. I have not heard from.
Can you give out the number?
Sure thing. Yeah. So we, as always, you can ask your question in a variety of ways. Well, I'm looking at our Facebook page where our post is. I take questions from there. You can contact the studio over at UMA, and the number there is 781-388-9394. And then you can always post to the live YouTube. We'll check that as well. And of course, if we don't get to any of your questions, always feel free to email us at info@cityofmalden.org, for the next one, or BOH response, same thing. And you'll get you'll get a more expedient answer than you'll get from us. We'll tell you to wait for the next show. They won't. So,
okay. All right, let's get through some of these then, Ron.
Sure. And actually I wanted to kind of reiterate the previous point, because I think it was really critical, because what I saw when we posted onto Facebook that we had these tests available, there were some people that were anxious and frustrated about why they weren't in their hands. And from what I'm hearing, and correct me if I'm wrong, it's almost as if to say, if you're one of the folks that knows enough to ask for one of these tests and is frustrated, you're probably not the best candidate for getting one of these. We're actually looking mostly for folks that hadn't thought of testing before and that really never approached it, whether it be from a financial standpoint, whether it be just, apathy, or any of those reasons. So if you're really in need of a test, you'll give us a call at our Board of Health, and that's 781-397-7049. And you can talk to our health department. And I think just to get behind what Chris said, we're not saying no to folks. We're just saying that the majority of these are going through those partners. And it's also important to say that those partners that we gave to, these aren't just these fly-by-night organizations that we just decided to pull out of a hat. These are organizations that have been helping us tremendously throughout the entire pandemic. These are organizations we trust and that have been doing outstanding work in the community. So I think they belong there, and I think they'll be treated, with reverence and given to the right folks. Next question, an oldie again, and I like this as a classic one. Okay. Can you get COVID a second time?
Who's that for, Ron?
I'm going to go Chris on this one. I see him sweating under his collar, so I'm going right after him.
No, yes, you can. Oftentimes, the second time you get it isn't nearly as, you won't get nearly as ill, but you could. I happen to know someone who had it twice. And this person has a suppressed immune system, so that helps, and all the things that the virus is looking for. The other thing is you could be fully vaccinated and be an asymptomatic carrier. So technically you're infected, but you're not sick, but you could infect everybody you come into contact with who isn't properly protected. So yes, the technical answer is yes, you can be twice.
And we'll go to Scune next.
Yeah, so SARS-CoV-2 is a virus. So just like you could get the flu after getting vaccinated, it's similar in the same way. So you could be vaccinated and get COVID and pass it to other people, and you could get COVID and then get it again. And if you're not vaccinated, not know the second time based on which variant you have, what that will look like. So yes, you can get it. The virus can be passed on. And even after you're vaccinated, you could get it as well and be asymptomatic, like Chris said.
Thank you, Scune. Let's go to Christian, but let's add a little bit to the end of this. And that is to say, depending on what your answer is, what is the frequency that you've seen this? And then what is the science saying on this?
So I'm going to agree with the other panelists. Yes, I mean, we haven't seen a lot of cases where people have gotten COVID twice, but there are cases and they do exist. I think there's still a lot to be learned about them. Why specifically are certain groups, or are they just really unlucky? But your body does build in natural antibodies to this And we have a lot to learn to understand why people are getting this a second time, but it is possible. So again, I think that's another reason why masks still need to be worn. It is such a cheap yet effective tool to help prevent people needlessly from potentially losing their life because somebody else was exposed and didn't, like Chris said, asymptomatic and brought it home. There's no intent, right? There was no intention of bringing it home, but they did. And it could make others sick, which is why masks still remain such an important weapon in our arsenal.
Okay, great. I can go on. I have more if we want to. Okay.
Yeah, try to go through some of the questions that have come in.
Yeah, sure thing. So the next question is with regard to getting your booster. I think it's important. It seems like this is the funniest thing. This is the most, omnipresent thing that I think in my lifetime. Yet when you ask what's seemingly a basic question, there's not a lot of folks out there that really know, for instance, where and how to get my vaccine, where and how to get tested. So we're covered the tested part. Let's talk about the vaccine, if you haven't gotten the vaccine yet, or the booster. Where are people getting their vaccines and boosters these days? Is it the same process it was, or has it changed?
To who, Ron?
Why don't we go to Chris?
Thank you. It has changed, but only a little. We don't have mass vaccination sites like Patriots Place and Fenway Park and things like that in their entirety. Mainly because the numbers don't support, the number of people needing to be vaccinated don't support reopening those. Now, if Omna had been different, we'd be talking differently. But right now, if you go on the state website, you can look, where can I get vaccinated is the question you have to ask. And it will give you by zip code where you can go. In Malden, CVS and Walgreens are still vaccinating, and they are still testing people. They also do have test kits. They run out very quickly, but they are available at those locations. The other location upcoming, the Department of Public Health has given the Malden Health Department a little time off over the holiday and has taken up the slack with the following clinics, which will be the 22nd and 29th at Linden Housing Authority, 5 p.m. to 8 p.m. That's the 22nd and 29th.
Of this month, Chris?
Of this month, December. And then again at Newland Street Housing on the 23rd and 30th. The 23rd is 11 a.m. to 4 p.m. And the 30th is 5 p.m. to 8 p.m. These are on the website, so you can have those things. If you have any more questions about that, please call the office and we will get you the information again. I will make sure it's up on the website first thing in the morning if it's not there already.
Let's go to Christian now. Same question.
So, there wasn't a whole lot of interest before Thanksgiving, but, right after Thanksgiving, due to, a lot of media coverage around the Omicron, discovery in South Africa, I dubbed it the Omicron effect because Monday morning after Thanksgiving holiday, there was a huge rush for people to get boosted. And, I'm so grateful that people have gone out to get boosters. Again, there are reports that there are many CVSs, they are full. I think there are places that are offering walk-ins. The Vax Finder on mass.gov is another excellent place where people can go. By putting in your zip code, you can probably find other pop-up programs that have started to emerge as we're trying to get the vaccine out to as many individuals as possible. Chris did talk about they are going to open up Fenway Park again in January. It's not always the most ideal place given parking challenges, but it is available. And we still have our vaccination center in Somerville that has been extremely busy. And unfortunately, many other larger vaccination centers, we have gone to an appointment-only program because wait times are extraordinary. So my recommendation to people is there are appointments. It may not be today, but you could likely find something later in the week. And it will, there are places to go. But I highly encourage people to have an appointment and not rely on just walking into some place with the hope of being vaccinated. Some will get lucky. I think some will be, should not be shocked that they'll be turned away.
I can vouch for the CHA site as I took my mother for her booster, and it was in a building in Somerville, which oddly enough used to be the old Bradley's. So I had a very strange feeling as though my mother was taking me shopping for sneakers, but no, I was getting her much ado important. And I noticed too, Christian, if you could clarify this, but I noticed in that vaccination center, there seemed to be different lanes, one for CHA patients and then one for state. So is that a state site and a CHA site at the same time, or?
So that is a public vaccination center. The reason why there's two lines, one's a CHA line, there's a different one. It's because the way there are two systems currently being utilized there. Obviously, we use Epic. That is a standard medical record system that nearly every hospital in Massachusetts uses. But because the patients have to be checked in, whereas anyone else who is using the state VaxFinder program, the state has a program called Color. That is just the maker of the program. The nice thing about Color is that the nurse, you don't have to go check in first. As soon as you go to the front of the line, the nurse can check you right into the system. So all patients, whether all CHA patients, once they check in, they essentially have to get into the proper line for the vaccine that you would like. And we have us to ensure that for safety purposes, to minimize risk of giving the wrong vaccine, the way it's planned is nurses are giving only certain vaccines, and then they're also managing children so that because there's the volume at that vaccination center is so high, we want to reduce any risk of mistakes as much as possible.
Jumping back really quick, I don't think it was covered, but when we talked about the tests that were given away by the health department to these organizations, those were rapid antigen tests, correct? Chris?
Yes, they are.
And so the process is you test positive on a rapid antigen. Does that tell you have to get a PCR after? Is that sort of like the JV to the varsity, or is it,
Yeah, it really is. The 15-minute test is not as accurate as obviously the PCR test, but it is a good measurement to prompt someone to go get a PCR test. That's the only way, if you come up positive, that you can clear yourself is with a PCR test.
Okay.
All right, Ron, let me clear through a few here that have come in. Chris, I did not ask this question. If I have no symptoms at all after receiving the COVID-19 vaccine, does this mean the vaccine did not work?
No, does not mean that. It means that your body was ready, if for whatever reason, was ready for the immune cycle to kick on. In that person's case, it probably is a huge immune response because they're relatively healthy, or it just for whatever genetic reason they had, it isn't going to affect them that way. There's a lot of people that I've spoken to at clinics who tell me they had no reaction from any of the shots, booster through. People come and tell us, "Wow, you guys do great work. I haven't had any problems with any of them." It shocks us when they tell us, but they're out there. They're lucky.
Christian, how long do the boosters protect against COVID-19 vaccines, and will we need a second one?
So I'm going to bet that we're going to be getting another booster likely in March or April. The two main manufacturers, at least for the United States, have already started the process of putting the Omicron variants into their vaccines for heightened protection. Obviously, those will have to go through. They're going to have to go through the clinical trials, and they will obviously have to go through the regulatory approvals. But I'm going to bet pretty strongly that another booster will be needed sometime in the spring.
Okay. Scune, I know you always err on the side of caution. So this question is, if I came in close contact with someone who tested positive for COVID-19, but I am vaccinated, should I still get tested?
Yes.
Unequivocally, right? No
Yeah,
hesitation.
no hesitation whatsoever. Yeah.
Okay.
Because even myself, I took a couple trips myself, and after I came back, before I met with anyone, I just went ahead and got tested at my local Walgreens with a PCR test, and was able to get the results within 24 hours that it was negative. But
Okay.
I went and got tested after all that. So those are still there. You didn't get a test kit, but you could still go to your local Walgreens, to the drive-through. You don't even need to see anybody, and get the swab and get tested and get the results fairly quickly. So those mechanisms are still there too, if you're able to access them and log in online to just be able to get those tests. So you didn't get a test kit, rapid testing, but there's still options to go to your local CVS or Walgreens to just get tested.
All right, Chris, this came in via email. Will children younger than 12 receive a vaccine card?
Yes. Every person that's vaccinated gets a vaccination card, regardless of age. It's a medical record just like any other. And if someone doesn't have one for their child, and you live in Malden, just call the health department. We can look up that record and prepare another card.
Chris, let's stay with you. What should a parent do if a child will turn 12 years of age in between the first and second doses?
The guidance on that is to go with the age the child is at the time of the vaccination, not what they're going to be, or, if whatever they are that day, that's the guideline you follow, no matter what the period after is. Could be days before he turns 13, but treat them as they're 12.
Okay. Christian, can you still receive a COVID-19 test for free without having any symptoms?
There are many places that are still offering free COVID tests. You can look them up on the state website for testing centers that are offering the testing for free. I think there are some places, obviously these, some of the urgent care centers who are charging, but there are a number of places where the tests are being offered free.
Christian, let's stay with you. How often, what does this person say? How often should I take a rapid test?
So, I'm not quite sure I'm the best person for that. Obviously, I think when people start to feel, that they're symptomatic, but, last year at this time, we got very fortunate because masking was so good. We didn't have our new little child that is now rearing its ugly head, and that is flu. So this year we are starting to see increased numbers of flu. So what is concerning is that regardless, if you don't feel well, stay home. If you do get a COVID test, it is negative. Please don't consider the idea that you are scot-free. You may have influenza, and so you should talk to your doctor whether you should be tested for influenza, or you consider going through your provider's office. They may be able to provide a respiratory panel, which will be able to test for RSV, influenza, and COVID-19 as well.
Can I just make a comment?
Please.
That's all true, and I want to just reinforce one thought I had, is that if you're in contact with somebody that you think, quotation fingers, may be not vaccinated or for some reason might be a carrier or infected, testing 20 minutes after you're with that person or the next day is kind of pointless. The virus needs a time to incubate, grow, and have an effect, and to be able to get to a level that it can be tested. So you want to wait 3 days, 3 to 5 days, and check yourself for symptoms. When you do, and you probably will if you're unprotected, have a symptom, then you take the test. Not because you were in proximity, but only when you stop. These 15-minute tests are not, laboratory grade. They're meant for quick, on the side of the road information kind of thing. And I just want to remind people that if you were going to do the testing like that, you just know when to do it. You're wasting your time going out, taking one before you go out to confirm your status, because it likely will change no matter where you go. If people are not masking, if people are unprotected. So just know that. Don't waste your kits. They're expensive and they're not going to be free forever. So test when you feel you've have a symptom. And if you have symptoms and they don't progress to COVID and you're still miserable, like Christian said, you probably have the flu. So again, I like to say this at least once every show: wash your hands, keep a mask on, and keep your distance. Those rules still apply.
Okay, Scune, if a COVID-19 home test comes back as positive, should you get one done from a doctor to ensure that the reading is accurate, or should you immediately quarantine? Or I guess do both?
I think definitely the confirmation with the PCR test, but both 100% with your provider if it came out positive to confirm.
Okay. Ron, back to you. Do you have any in the queue?
Yes, the mandatory vaccines for workplaces or for government. I think what we're trying to do is see an update on where the panel sees the trend going, in terms of where government's at, whether it be local municipalities or at the federal or at the state level, and then private businesses. Where is the trend right now? Are we heading towards businesses being a little skittish about the mandate, or are we seeing a full force approach to it?
Well, the federal one, Ron, I think just cleared the appeals court, right?
Yeah, I think that's what I was hoping that the panel
Yeah.
would address too. So
Do you
if
see
could,
that? Do you see that going to the Supreme Court, or?
we're going to go Scune on this one first.
I think definitely at the federal level, somebody's going to fight it.
Yeah.
Definitely somebody's going to fight it. But I think for the private sector, we have already seen, like healthcare, for example, they're frontline and I think a lot of dates, and for the people that were not in compliance, they were met with termination because of the nature of the work. And so I think for the private sector, definitely the mandate is held in there, but at the federal level, that I foresee just fights for sure.
Okay.
Let's go to Chris next.
Yeah, I would agree with that. On the federal level, I do think it's going to have to go to the Supreme Court. There's some talk that even some state district attorneys are going to do, push that button anyway, just so that they don't have to face the challenge locally. Ultimately it comes, it's the same old thing: mask up or get vaccinated. There's really no other choice. As long as, honestly, I never thought we'd be doing this, all of this work that we're doing to this extent, this long into this. I told the mayor 2 years ago, this will burn out hopefully in 14 months.
Right.
And if we do everything right, that's exactly what should have happened. But we all know the history, so I won't get into that.
So Chris, let me stay with you. Let me segue to this question. Is herd immunity a lost cause?
Well, if you can close your borders, you can have herd immunity. But as long as there's free travel and there's a possibility that someone may come in with a variant, you kickstart the whole process all over again. So herd immunity is good if you have a meningitis outbreak. You don't know, that's a bad example. You don't want to have a herd immunity with meningitis. But anytime you talk herd immunity, it isn't really about stopping practices that will turn back the disease. It's just a way of saying we can now expand what's the community should be able to do safely. That's all herd immunity does.
Okay. Let's see. Can COVID-19 tests detect particular variants? Christian?
So I think it depends on the maker. There are, many of the at least hospital grade analyzers are automatically picking up the Omicron variant. So that is good news. I cannot speak to the private sector and what various manufacturers are able to do. I think, like anything else, I think doing some homework and some background on it is a good tool to determine if Omicron, I think, will be within weeks. This will becoming more of a predominant variant for this country, just because the way the replication factor, how quickly it's replicating. The only good news on this is that it is, people are experiencing mild symptoms, whereas Delta has been quite challenging, and it's been quite tough on many people.
Christian, how can that be then? I thought each variant becomes stronger. Are you saying that Omicron is less damaging than Delta?
It's certainly more contagious, right? It is. We know that it is certainly more contagious, but it is not having the effects that Delta had. And I think there's a lot to understand why. I think there's still a lot that we don't know about its behavior. There are 30 mutations as part of that variant, but there's still a lot we don't understand why. And this is really taking data both from South Africa and the UK, where the hospitalization rates have been quite mild, but they're especially in the UK, where their transmissibility rates are skyrocketing at the moment. I mean, they've got significant challenges in the UK, but the US is starting to see a little bit of an increase. Again, the US is, I think, continues to struggle with the dominant variant for us is Delta still in this country.
Okay. Ron, let's try and clear whatever you have left. I know we have just a few minutes left.
That's it. I did want to leave that amount of time for our guests to wrap up, but yeah, I'm clear on my end.
Okay, very good. All right, well, let's go around the horn one more time for our panelists to give us some closing thoughts and how to get a hold of you if someone didn't get to ask their question tonight. So, Mr. Webb.
Thank you, Mayor. I just want to take the opportunity to remind everybody about those clinics again. The Linden clinics at the Linden Housing Authority Community Room are the 22nd and 29th of December, 5 p.m. to 8 p.m. Walk-ins are welcome. You can register online as well. They are on the VaxFinder website. The 275 Newland Street Housing Development Community Room. The 23rd is 11 a.m. to 4 p.m. and the 30th is 5 p.m. to 8 p.m. They will vaccinate you. They will give you a booster, and they will do pediatric there as well.
Okay.
If you need to reach me, the best way to do that is 781-397-7049. And my email is cwebb@cityofmalden.org.
Okay, Christian.
So I want to thank the residents of Malden for, again, allowing me the opportunity and the honor to be able to talk to all of you. And I want to reiterate something that Chris said. You cannot take a test immediately after you think you have a potential exposure and determine that this test will have an effect. You need to give it 3 to 5, maybe possibly 7 days for you to really fully understand your test results. But with that, I look forward to seeing you again, all again. I think we will be back here, but I can be reached at clanphere@challiance.org.
Okay,
Thank you,
Mayor. Thank you.
So City of Malden, thank you for tuning in tonight, and having had the opportunity to travel to 2 other states that have taken this virus very, very differently. I'm just really grateful to just live in a city and also in a state where test kits are being sent out to lower income residents, and that I could go to my local Walgreens and schedule a test and a vaccine and have it be readily available. So just feeling a sense of gratitude, and do know that these resources are out there and for you to take advantage of them. And if you do need to reach me for any reason outside of this, I can be reached at bohresponse@cityofmalden.org. And I just want to wish everybody who celebrates it a very happy, safe, healthy holiday. And don't forget your mask too, because if we're going to be indoors quite a bit, do that. And I wanted to take a chance to just, with my gratitude, show my City of Malden ornament, and just a sense of gratitude overall for the city, the mayor, the governor, and having been in other states where they've taken this, not as in the same level that we have. So just full of gratitude, and thank you for tuning in.
All right, Scune, I'm going to trip you up. I'm going to go around the horn because one question we didn't ask is holiday plans. So are you keeping them, or are you looking to postpone or cancel them?
Nothing with groups at this moment. And so it's just going to be myself and my husband. We're just going to be hunkering down.
Okay, Christian, holiday plans, should people keep them or think
So
twice?
I think people should use caution. I think people should just use caution, and take all, especially if you're going to visit, particularly either younger or elderly, take all the prudent measures. We want them. We want to see them all in 2022.
Okay.
And we're looking at a tough winter, but we'll get through this one.
All right, Chris, same to you. What are you recommending for people to do?
I'm going to do the same thing as Scune. My wife and I are hunkering down. I know it's difficult. I'm different set of circumstances for me. I don't have kids at home anymore. And if I did, I'm sure I might be different about it. But I would, like Christian said, concentrate on the day, have fun. But we've been at this a while. Most people know what they need to do. Make sure you have ventilation. Make sure you wear masks when you need to. And that's whenever you're in a company with somebody, you don't know their vaccination status or are uncomfortable of asking, just put on a mask. Save yourself that aggravation, and them for that matter. And wash your hands. Wash your hands. There's going to be a lot of plate passing. Please wash your hands. Be cognizant of you're laughing, and don't enjoy yourselves, but be safe with your emissions. Okay, keep that in mind at all times. Spread out, ventilate when you can, and more importantly, enjoy your loved ones and those close to you. Try to stay away from people who you don't know their vaccination status.
Okay. All right, very good. Well, on behalf of Ron Cochran and Urban Media Arts and all our panelists, we want to say thank you for watching. And we will say once again that this is a marathon, not a sprint. So let us continue to work together. And in the meantime, we wish you all a very safe and happy holiday season.